Well, with the start of fall comes the start of flu season, and the Centers for Disease Control is urging everyone to get a flu shot to avoid serious illness.
Dr. Christopher Parker is with the CDC, joins us now live. Doctor, thanks for being with us.
Thank you.
I was surprised to see that only half the country got the flu vaccine last year. Is that down, and do you attribute that to the general kind of conversation about vaccine hesitancy?
Yes, we know that there have been a lack of uptake with the vaccine, even though we found that there was a 50% decrease in the risk for hospitalization among people who got the flu shot. Less than half of the country got the flu shot. And so we're working with the Ad Council, the AMA, and the CDC. We're partnering to encourage everyone to get their flu shot this year.
All right, and it seems like every year, obviously, we talk about this, but is there anything particular about this year that maybe people should pay a little bit more attention to when and how quickly they get their flu shot?
Well, we know that the flu normally runs, it can begin as early as October and run through the month of May, with the peak being in February. And so we're encouraging everyone to get their shot early so that they are protected. They are protected, their family is protected, and our communities are protected also.
Do you see different flu vaccine uptake in different communities?
Yes, we know that there is a lack of uptake in the African American community and also in the Hispanic Latino communities. But we also know that it's critical for them to get their flu shot because hospitalization rates among those populations are higher as compared to white adults.
Yeah, and we saw that a lot during the COVID pandemic. A lot of them did not want to get that COVID vaccine, or kind of wanted to slow it down a little bit. Talk to me about what has changed since then, how you've been able to target that audience to make sure that they, one, get their COVID booster and get the flu vaccine as well.
Well, we have this campaign, again, with the Ad Council, the American Medical Association, and the CDC, to where we're attempting to educate and encourage. The goal is to encourage everyone to get their flu shot. And also, CDC expects that this fall and winter flu season, that there are going to be several viruses that are spreading. And so we're encouraging everyone to get their flu shot, the updated COVID vaccine, and speak with their healthcare provider to find out if the RSV vaccine is appropriate for them.
And you mentioned that updated COVID vaccine. Can you get that at the same time that you get the flu vaccine?
Absolutely. We're encouraging you to get both of them at the same time.
Okay.
And do we know, are side effects from the new COVID shot as strong, intense, as they were with some of the other boosters, previous boosters?
We know there have been some report of minor side effects, but we're asking everyone to speak with their healthcare provider if they experience any side effects in relation to the vaccines.
All right, sir, I got to ask you this because I've got a 4-year-old at home who is the love of my life, and I talk about all the time. But, you know, obviously we were discussing.
Careful, she'll start showing
I'm
pictures.
sorry, I can show you pictures, sir.
Yeah.
But I wanted to ask you, you know, one of the things that our pediatrician talked about is this idea of a flu mist rather than the flu shot. Anything that you can weigh in on that?
Well, that decision you should make in conversations with your medical provider. We can say it's very critical that in certain groups, people 65 and over, children ages 6 months to 5 years, that they get their flu shot because we know it protects them from severe illness.
Okay. Dr. Christopher Parker with the CDC, thank you for being with us. Up next.